Of provinces are close to experiencing a third wave of COVID-19, particularly Gauteng is already in the midst of it. Just yesterday, the Education Department announced it's suspending contact sports in schools, this until the infection numbers improve. But to discuss the latest COVID-19 numbers, I'm now joined by Mr. Bruce Millardo, who has been working with the Gauteng COVID Advisory Council. Mr. Millardo, thank you for your time. This is quite serious. Gauteng, I know, is officially in a third wave. That number, panning in over 3,000 infections just yesterday. Where are conversations now, particularly when we look at the Gauteng Advisory, Council on COVID-19? Is a stricter, lockdown imminent at the stage?
Thanks for having me. So you're correct. We have been observing the number of cases and other indexes growing in a sustained manner for the past 2 weeks. That thing started about 2 weeks ago where we had a differential of 60%, and that repeated again itself a week after. So that certainly is quite worrying. Another important sign that we are in a serious situation of resurgence is that areas like Sedibeng are technically in high risk, and if you look at the same time at what happens with our mobility in the province, we have one of the highest mobilities since the hard lockdowns last year. We are in a situation very similar in terms of mobility as we had right before the second wave. So when you have those high numbers in certain areas such as Sedibeng and other sub-districts of Johannesburg and Tshwane, you obviously are becoming very worried.
Yeah, speaking of that worry, Mr. Millardo, I suppose South Africans are wondering if our healthcare system does have capacity at this stage, to handle the influx of patients, I can assume at this time, either testing positive, but also who need medical attention at this time.
So what we do as a committee is we look at the numbers very carefully on a daily basis, almost real time, and we run calculations, we crunch numbers, and make estimates of where we will be in the next weeks to come. So far, if you look at the way the pandemic is evolving, it appears that we should be able to sustain a new wave, given the characteristics of the numbers that we have received so far. Now, this is obviously, we can only argue at the moment in that we are looking at the numbers as they come. Obviously, we would like to see a very sudden or very large acceleration of numbers. Now, we look at what we have today and the numbers we have received, it appears that the resources are in place in order to deal with the situation where the numbers become bigger.
Right. And with that being said, because we're still in the middle of a vaccine drive across the country, what are some of the plans in place, I suppose, to expedite this process? Because there's still a backlog of healthcare workers, to be vaccinated. We're in phase 2 now, focusing on senior citizens as well. With this third wave coming, the numbers increasing, is there a plan in place to ensure that more and more people get vaccinated at an urgent rate?
Indeed. I mean, the role of our committee is to basically advise based on the numbers we get. We also get reports from the Department of Health as to where the vaccination is. As you know, the vaccination phase 2 has started already as of May 17. That's obviously a great thing that we are having growing numbers, but at the same time, there is vaccination of people over 60 already taking place, which are the most vulnerable. And such action will severely reduce the probability of severe disease and mortality. So it's very important that proceeds. As far as the reports that we are getting so far are positive in that the campaign is progressing.
All right. And before I let you go, then I suppose just a stronger message and warning to South Africans. I mean, there's still vaccine hesitancy. There's still questions around even COVID-19 exists or not. But the numbers are showing that infections are indeed increasing. What then would be the message, the important message at this time?
Right. So it's very clear that we are in the middle of a resurgence and the numbers will keep growing. That's very, very clear. That's very worrying. And the fact of the matter is that these numbers are growing before we were able to roll out the vaccine in a massive way. So this means that we have to adhere to social distancing more than ever in order to slow down the numbers that we have. And it's very important to raise awareness about this, is that it is within our power and it depends on our behavior as a society to actually slow down these numbers. It's not like the numbers go and there's nothing we can do. That's not true. We can do a lot by basically avoiding unnecessary social interactions and wearing masks and following other rules and regulations when required.
Thank you so much. Bruce Milado, a pleasure talking to you. Thank you for your time.